Yet another crisis. This one's been labelled the healthcare crisis. Every single day we have another crisis, apparently. I mean, do we? Or is this just people desperate for people to be frightened for some reason? I want to know your thoughts on that. But in England, analysis has apparently shown that on average, just one GP now for every 2,000 people. That's a 5% rise since 2015. Some areas are seeing a rise of around 40% of people per GP over the same period. Hull, where I'm from, is apparently one of the worst affected areas. It has one GP for every 2,821 people, compared to the Wirral, which has one for every 1,279. Elsewhere, figures from the health department show that from 2019, as I mentioned in my intro earlier on, apparently GPs were then working the equivalent of a 3-day week. And now there's been concerns, of course, that it's even harder to see your GP. Here's what the Shadow Health Secretary has told GBNews earlier today.
We simply don't have enough GPs. And actually, Boris Johnson promised us 6,000 extra GPs, but where are they? He's not delivered. It's another broken promise from Boris Johnson. Secondly, we're all complaining about not being able to see a GP in person, and quite rightly, I understand those complaints. But it was actually the government's policy, not in the pandemic. Pre the pandemic, Matt Hancock, remember him? He was the health secretary, saying that we all had to go to Skype interviews to see our GPs. So this is actually government policy. The third thing is, GPs have been so overworked that more and more of them are moving to these flexible working models because they are so burnt out. But that's simply because we don't have enough GPs in the first place. So Boris Johnson, you promised us 6,000 GPs. Pull your finger out and get us those GPs that you promised, because at the moment you're failing to deliver, and it means patients are missing out.
Well, we've had a doctor. Dr. Vina joins us now. Good evening to you.
Good evening.
You just heard the Shadow Health Secretary saying that the government needs to pull their fingers out and get doctors on board. Well, you've just become a GP, is that right?
I have, yeah, and I qualified right in the pandemic. So I was there overnight where things went, from 100% face-to-face to us being told you have to triage everybody before deciding to get people in. So I qualified during that exact period.
And Dr. Babu, what do you think to the criticism that's levelled at your profession right now? There's a lot of frustrations with GPs, quite a lot of negative headlines coming out. Do you think it's fair?
No, I don't think it's fair, I have to be honest. And it's quite hurtful because I know how hard myself and all my colleagues are working, not just now, but during the entire time of uncertainty when the pandemic hit. I assure you, I'm a full-time GP. I work anywhere between 45 to 60 hours a week. Now, the data that, the newspapers are using talks about sessions. So a session is anywhere between a 3 to 4 hour clinic. GPs work outside of these sessions. We work in urgent care, we work in A&E, we do baby clinics, we do hot hub centers. There's so much that goes on outside of the GP practice. So when data just looks at the sessions, it might seem that they may just work 2 sessions or 3 sessions, but we are working outside of that as well.
But surely, though, you would concede that there is a problem when it comes to people getting access to their GPs, particularly face-to-face.
Yeah. And I think, a part of it is obviously to reduce risk, to mitigate the risk of bringing elderly, more vulnerable patients into a building where, they might have contracted COVID or they might infect somebody else. So what's happening now is we triage a majority of the patients. So on the day, if someone is acutely unwell, there's an on-call list. Everyone gets spoken to. If they need to be assessed, they'll be given a face-to-face appointment. So if I talk about my day today, each clinic had about 18 to 20 patients, of which 50% I saw face-to-face. So I think the data might be a little skewed, and it's not true that we're not working to see patients.
But then when you're talking about triage, I understand the system you're referring to there, but it's also undeniable that a lot of people are having misdiagnosis now, because when you're going through triage, for example, somebody on the phone, whether it's a doctor's receptionist or whoever it is making the decision that actually you don't need to see a doctor when in fact they did.
Yeah, so I think it really depends. Technology helps us in the sense of people are able to send images through, you can do video consultations. But then some people may argue, with the elderly population who might not be as tech savvy, they may lose out on that and they may actually want to see someone face to face. So I think as the months progress and as we get majority of our population vaccinated and in a much safer place, we will be steering more towards face to face.
Yeah, do you not think your approach has been slightly overcautious though?
On this particular occasion, no, because we have to follow guidelines. And even if I personally wanted to do something, we'd have to think of our community as a whole. And if we felt there were, teams in the community, like say nursing teams, district nurses, occupational therapists, who could go and enable patients in their homes, we try and work together so we can kind of, enable one another in that sense.
Yeah, help me to understand then, because I'm one of those people that I just couldn't get a doctor's appointment for love nor money, and I had to use a private GP service. And what I've noticed is that whilst the experience you're reflecting here is accurate with the NHS, i.e. there's all this cautious approach, it's never been my experience, certainly within the private GP sector. It's been incredibly easy to get a face-to-face GP doctor. I've had them throughout. So why is there a disparity between the private sector and the NHS?
So that's quite a broad question. And if I'm honest with you, I think the truth would be, as a GP practice, we serve a community of anywhere between 10 to 15,000 patients, right? So the demand is huge on the services. Whereas if you're a private service providing, the resources to the customers paying, the numbers may not be that big. You may have a pool of doctors available at any given time to fill that demand. Whereas when you're working in a community, you're working with much larger numbers. So there's a lot more to really think about.
Final question, I guess, just to help people understand. If you qualify as an NHS GP, are you allowed to just pick and choose how many hours you work for the NHS and how many hours you work for the private sector? Or do you have a minimum set of hours for the NHS? How does it work?
Yeah, that's a very good question. And the answer to that is, once you're qualified, it's completely up to you how much you work and what kind of work you want to do. So you could either be salaried and take full-time positions where you work 5 days a week, 4 days a week. You may decide to go into medical education. You may decide to work more in an A&E setting. It's a career in essence that you can craft and architect as you like. So each person may do what might suit their life, depending on where they want to be.